So my name's Ann Yeh. I'm a neurologist, a child neurologist at the Hospital for Sick Children in Toronto in Canada. And my research interests are related to children with pediatric MS, and specifically outcomes, physical activity, wellness, and as well I dabble in other things related to the eye, to visual outcomes, and to therapies. That's a very good question. So children with pediatric MS tend to have severe disease at onset, and many people have looked at differences at onset and found that there are more relapses, and as well the burden of disease is higher at the beginning. Importantly, the course of the disease is different in that the secondary progressive phase seems to come a little bit later, but it does come quite early on in the 30s. So there are no disease-modifying therapies which are approved for children with MS. Nonetheless, they do work for kids with MS, and we use them. They're widely used, and as well, they seem to be effective. Yeah, pediatric MS is only one of many inflammatory disorders of the central nervous system in children. The most commonly discussed one is other illness is acute disseminated encephalomyelitis. There are other new phenomena that are being talked about, like MOG antibody-associated encephalitis or optic neuritis, ADEM with MOG, and of course there are other things that are the same as in the adult population, clinically isolated syndromes. So pediatric MS has, and as in the adult population, has a very characteristic appearance on MRI. So following strict diagnostic criteria, there is a very clear way to distinguish kids with MS from other kids. And that has to do with lesion localization, recurrence, and other ancillary testing like oligoclonal bands.